My name is Jim, and today you're going to learn how to unfuck your knees in 3 easy steps. Let's go. Give you some background. I have my Bachelor of Science in Exercise Science or Kinesiology from Florida Gulf Coast University, and I'm also a certified strength and conditioning specialist with the American College of Sports Medicine. Step 1 would be to identify the issue that you have going on with your knee. Hopefully it's a chronic degenerative issue, as that is the main knee issue that we are treating in today's video, such as patellar tendonitis or jumper's knee, the most common, Osgood Slaughters, or quadriceps tendonitis, which is something that I have been suffering with for the last year or so. Disclaimer: if you have any acute trauma or known connective tissue tear in your knee, such as a ACL tear, torn meniscus, turn this video off. It's not for you. Go seek treatment from a surgeon or a physical therapist. Step 2 is the act of regression. Regression means basically, first of all, identifying your activities that cause pain, such as for me, playing volleyball, lifting heavy weights in the gym, and toning it back to a level that's comfortable without pain, whether that means very minimal activity or decreasing your set rep scheme in the gym or your weight or load being lifted so that it is something that does not cause you pain every time that you're doing that activity. The next step of regression would be to work on key areas of deficiency in your knees, such as strength, range of motion, as well as strengthening the connective tissue in the knee as well, and surrounding musculature of the lower extremity. I have curated 6 of my absolute favorite exercises that I'm going to demonstrate for you in today's video. Exercise number 1 would be the reverse treadmill or deadmill, or the reverse sled. As you can see here, I'm walking backwards on a treadmill that offers very little resistance, and all I'm working on is just gaining proper blood flow into my knee and surrounding musculature and connective tissue of the lower extremity. And it just kind of acts as a great warm-up to activate your lower body and get ready for more intense training. Next, we have the holy grail of all knee exercises, which is the Poliquin step-up. This exercise is performed on an elevated surface. Variables included in this exercise would be how high the surface that you're elevated off of and any weight that or resistance that you're carrying as well. Basically, you're going to support yourself on one leg and drop the other leg down until your heel hits the ground with a slightly bent knee joint. You want to then extend through your hips, knees, and ankles, feeling the majority of the resistance, not as much as in your knee, but mainly in your tibialis anterior, which we'll get to more later in the video. The following exercise is now the Nordic curl, or the glute ham raise, as some refer to it as. Essentially, you're just supporting your heels underneath a surface that will not be going anywhere, such as this rack that I'm using, and you're going to keep your hips extended and lower your body down as far as you can while maintaining some resistance against gravity until your hamstrings are not strong enough to keep your body off of the ground. Then you just let your body go, catch yourself with your hands, push yourself back up. Next is similar, but reverse, now targeting the quadriceps muscles, specifically the VMO muscle in your quad. This is going to be the reverse Nordic. Essentially, you're doing exactly the same, except there's no need to anchor yourself under any resisted surface. You're going to work yourself, now further extending your torso, concentric on the way down, and then concentric, you will lift yourself with your quadriceps back to the upright position. Exercise number 5 is the tibialis raise, the shock absorber of the lower leg, and very important in fixing knee pain. So basically all we're doing is going into dorsiflexion while we're leaning against the wall, hands underneath our buttocks, hold up top for about a count of a second, and then drop our toes back down. Exercise number 6 would be foam rolling, very important, and not truly an exercise, but myofascial release is just about as good as it gets in maintaining an optimal length-tension relationship in the musculature of the lower extremity.
And the final exercise that we're looking at here is the sissy squat. Terrible name, great exercise for strengthening the connecting tissue of the knee, as well as the prime movers of the knee joint, including the quadriceps group and the tibialis anterior. It's basically performed by squatting down on your knees. Regression includes using an elevated surface or some sort of support object to help you on the lowering process.
The next step is now progression. Now that we've done a comfortable set rep scheme, not working through any sort of pain, You will continue to progress, not with pain, but to a level that reaches comfortability, and continue with the theory of progressive overload, aka continuing to try to do better every time exercising without injury, without working through pain. You're going to progress with these exercises and increase the level of activity that was injuring you before while maintaining a comfortable level in your body. Let your body be your guide here. I'd say in terms of set rep scheme, it's important to maintain a set scheme of 4 as well as a rep scheme of anywhere from 6 to 10 so that we are training strength. That's going to be the real X factor in improving yourself, is are you able to do these exercises with not only your body weight but increase the load so that your body will specifically adapt to the demands imposed on it. And there you have it. You're fixed. Or are you? You need to keep in mind that preventing pain is not just a practice that you're able to do or should do for a couple of weeks to a month until you no longer feel pain while you're doing the activities that you love to do, but realize that it's actually more of a lifestyle, that you need to be practicing this day in, day out like it's your job. In order to maintain the lifestyle that you wish to do, you have to do the work in the background as well. So being consistent is the most important thing with these exercises. Once you create a kind of regimen and play around with the variables that works best for you, that you're able to do that consistently so that you're able to continue to do the activities that you love pain-free. And there you have it. I hope that you enjoyed this video and found some sort of benefit from this and are going to incorporate this strategy into maintaining a healthier lifestyle and a more pain-free living. Thank you guys.